Hi, I'm Dr. Bhargav Raut from Pathofast Lab Pune, and today we are going to talk about the hepatitis B serology. What are the different types of markers, antigens, antibodies, and tests that are done for hepatitis B? When do the different antigens appear? When do they disappear? What are the different patterns that are seen? For example, if someone is actively infected, if someone has a long standing hepatitis B infection, if someone has been vaccinated, or someone has never been exposed. I'm going to explain all this in a very easy way so that you will never forget how hepatitis B infects, works, and which are the best tests to do at which stage. Thank you. In order to understand the serology, you have to understand the structure of the hepatitis B virus. It's a DNA virus with DNA inside, right in the middle, and it has a couple of layers around it, which I'll explain in detail in the subsequent slides. So first, let's look at the structure of the hepatitis B virus, because the entire serology and all the tests that are done for hepatitis B are based totally on the structure. The hepatitis B virus, right inside in the middle, you can see in the pool of yellow, there is the DNA. That's right at the center of the virus. Immediately outside this, you can see there's one thick black circle, and that is called the core of the virus. That's where we find the hepatitis B core antigen. Then you have that lake of blue just outside the innermost black line. That's called the envelope. And outside that is the last layer, which is called the surface. And that's where we find the hepatitis B surface antigen, which is usually the first test that is done to screen for hepatitis B. So that's a simple overview of the hepatitis B virus particle. So here we are looking at the hepatitis B surface antigen. It is present, as the name says, right at the top outside on the outermost layer of the hepatitis B virus. This is the first antigen that appears when somebody is infected with hepatitis B. You can see these yellow balls which I've drawn right on the outermost ring of the viral particle, and this is called the most important marker of hepatitis B, because if this is present, that means you currently have the infection, whether acute, whether chronic, it doesn't matter. If your hepatitis B surface antigen is detected in the blood, that person currently has the virus, and that's why this is such an important antigen. So when does this hepatitis B surface antigen even begin to appear? Because when a patient comes to you, he would like to know, he or she would like to know, how soon can they be diagnosed with this test. So the short answer is, it usually appears around 2 to 3 or 4 weeks after the infection. 2 to 4 weeks is the usual time when this will show up, so around about a month. And the best part is, it will last for around 24 weeks or 6 months if the virus is successfully cleared by the body. So that makes it easy to remember. It appears around 2 to 4 weeks and it disappears at around 24 weeks. So 2424, that's a simple way to remember it. So the next is the hepatitis B envelope antigen. As I told you in the first slide, this is that lake of blue that is present between the two coats of the hepatitis B viral particle. These are the red dots that I've marked in the image. The hepatitis B envelope antigen usually reflects a high rate of replication of the hepatitis B virus in the body, and it also means that the person is very highly infective at this stage. So the hepatitis B envelope antigen is usually something that will appear a little bit after the hepatitis B surface antigen. It means that the virus is replicating fast, and this person and his close contacts have to be quite careful, because he can easily, or she can easily spread the virus, because it is actively replicating in the body. Next and the last one is the hepatitis B core antigen. You can see them as the little blue circles that I've drawn on the innermost black ring. So the hepatitis B core antigen is present right inside the viral particle. Even if someone is infected with the hepatitis B virus, and irrespective of the stage, this core antigen is never seen in the blood. There are some very rare cases where it is seen. In fact, some labs even measure this level, but by and large, this is not supposed to be seen in the blood. Its only value is that it generates antibodies in our body, which we then use to tell whether somebody has ever been infected with this virus in the past or not. So that is its only real value as far as clinical assessment of hepatitis B goes. I'm now going to talk about the antigens and their corresponding antibodies together, because this makes it very easy to understand the serology of the hepatitis B virus. So we are first going to talk about the HbsAg and the anti-HbS antibody which is created against it. So let's talk about the hepatitis B surface antigen and the hepatitis B surface antibody. As I've already told you, the HbsAg surface antigen is the first thing to be seen when somebody is infected, and the anti-HbS is an antibody created by our body to fight against the hepatitis B virus. If someone has cleared out this virus, if somebody has beaten the virus out of their body, or if they've been well vaccinated against this virus, the anti-HBs antibodies will be seen. In fact, the anti-HBs antibodies are usually considered to be a marker of complete recovery from the infection or adequate vaccination. So, what are the different patterns that we see in different conditions of these two together? Let's say that someone was never exposed to the virus. In that case, both the HbsAg and the anti-HbS will be negative. Let's say that someone has been exposed but they have recovered completely. Well, in this case, the HbsAg will be negative and the anti-HbS will be positive. It's the same if they were vaccinated. You're not going to get any HbsAg because the person was never infected, but because of the vaccination, the anti-HbS level will be high. Now, the last two situations are in somebody who is either actively infected or who has not been able to clear the virus and has gotten infected since a very long time. In both these cases, you're going to find that the HbsAg is positive, which means that the virus is there in the body, but the anti-HbS, which is the antibody, the body's defense mechanism against the virus, is negative. So, this is the pattern for HbS and anti-HbS in different conditions. Next, we are going to talk about the HbeAg and the anti-HbeAg, which is the hepatitis B envelope antigen and its corresponding antibodies, and why they are important and what are the different patterns that we see with respect to these two as a pair. So, what is the real value of this HbeAg test? Well, it indicates that someone who has the virus is now very actively infective, that they can spread this virus very easily if they come in contact with somebody through one of the modes of transmission. And what does the HBe antibody indicate? Well, the opposite, that this person is no longer replicating this virus very fast. The body has mounted an immune response against it, but it does not mean that the person is completely free of the virus or that he can't spread it. So, what are the different patterns of HBe and anti-HBe in different conditions? So, let's say somebody was never exposed. Obviously, the virus has never gotten into their body, so both of them are expected to be negative. Let's say that someone was infected but has recovered. Well, we can be certain that there will be no HBe because this person cannot obviously be actively replicating now the virus, but the anti-HBe will be positive because that means that there is some immunity. What if somebody was vaccinated? Well, that's the same as if somebody was never exposed. There shouldn't be either of these two detected. What about an acute infection? Well, right now HBe will be positive, but the anti-HBe will be negative. In a chronic infection, a long-standing infection, HBe may or may not be positive. Anti-HBe antibodies may or may not be positive. Now, let's look at the HB core antigen because this is something that should never show up in the blood. But the anti-HBC antibodies, they help us to know whether somebody was ever infected in the past or if they were very recently infected. So, this is a really interesting and important set of markers. First of all, it's important to know that there are two types of hepatitis B core antibodies. The first one is the anti-HBC IgM, which is a recent marker. It will be elevated within the first few months of the infection, and that is why it is termed as a recent marker. So, if it's present, it tells us that this person was recently infected. The second one is the total anti-HBC, which includes the HBC IgM and the IgG. As you know, IgGs are long-lasting antibodies. So the presence of this antibody above its cutoff will tell us that there was an infection in this person at some point in the past. We just don't know when. Now, what does these two antibodies mean in the different patterns of infection? So let's see, if somebody was never exposed, you know that both of them should be negative. If somebody has recovered from the infection, we expect that the total anti-HBC will be positive and the IgM anti-HBC will be positive, but initially. If somebody was successfully vaccinated, we expect both these things to be negative because, as you know, the HBC is only present in the hepatitis B viral particle itself and it is not present in the vaccine. So, the vaccine does not elicit the manufacturing of these antibodies. Now, what if somebody was recently infected? Well, the total anti-HBC will probably be negative, but the IgM, which is the antibody which is created in a very recent infection, will be positive. And what about a chronic infection? Exactly opposite. Because this is a long-standing infection, we expect that the total anti-HBC will be positive because that will include the IgG antibodies, but the IgM anti-HBC, which is relevant to a recent infection, will be negative. Now let's take a look at what will be the serology or the set of blood tests if somebody has never been exposed to the virus. Well, the first and simplest thing to understand is if someone has never exposed to the virus, nothing is going to be positive. You're going to get negatives on all the different tests that exist on all the different markers. And the reason for this is really simple. If the viral particle never entered your body is never going to make any kind of antibodies against it. So all the antibodies are ruled out on the spot. And secondly, the two antigens, which is the HbsAg antigen and the HBe antigen, none of them are going to be seen in your blood because the virus never got in. So here it's really simple. Everything is negative. The virus was never inside the body, and all the possible tests are just going to turn up blank. So that's all you need to remember in this situation. Now we'll go ahead to the next situation, which is what happens if someone has had the infection in the past, but that infection has now gone away with a very good immunity. That means the patient has cleared out the virus with strong immunity. So what are the set of patterns that we are going to see? Well, because the immunity is good, the first thing that you will obviously realize is that the anti-HBs, which is the one that gives us protection against the virus, is going to be positive. It's going to be about 10. The anti-HBC is total anti-HBC is also going to be positive, because we know that the HB core antibodies are only made if someone was exposed to the virus. So that's the second thing. And the third thing is that the HbsAg, which is the surface antigen, is definitely going to be negative, because this person has cleared out the virus. So the HbsAg should never be seen in someone who has cleared out the virus, so that is going to be negative. That's all you need to remember if someone was exposed but has successfully cleared out this virus. Now let's look at the situation where someone was infected in the past, they have cleared out the virus, but now their immunity has started waning. The body's immune system has become a little weak for whatever reason, maybe age, maybe other diseases. So let's see what it's going to look like in that. Well, there's going to be only one major change. One is that the anti-HBs levels, which were a strong or positive when the immunity was good, these are the ones which are probably going to have dropped below 10, because 10 is the cutoff for good immunity. So anti-HBs will be below 10. The anti-HBC, especially the total anti-HBC, which is the core antibodies, they are going to be positive, because we know that this person was infected in the past. But everything else, that is the HbsAg, the HBe antigen, all this stuff should be negative, because even though they have cleared out the virus and maybe the immunity is a bit low, we don't expect a reactivation of the virus in these people, even if the anti-HBs is a little below 10. So this is the pattern that you're going to see in this scenario. Now let's take a look at what we are going to see if someone was successfully vaccinated, because this is the biggest difference. Here the best thing is that you're going to see the difference between someone who was infected and has successfully cleared the infection, whereas someone who was vaccinated, and there is only one difference between these two, and that's what I'm going to tell you in the coming slide. So let's say that someone has been successfully vaccinated. We know that the anti-HBs level should be above 10, and this will be the same as someone who has also previously cleared the infection. But the biggest difference is the total anti-HBC level will be negative, because that is a marker which only shows up if someone was actually infected with the virus. Why? Because the vaccine does not contain the HBC antigen. The vaccine only contains the HBs antigen, and this is the biggest difference. Everything else, like the HbsAg being negative, the HbeAg being negative, all these things are going to be just the same as someone who had the infection in the past but has successfully cleared it. But the anti-HBC, and especially the total anti-HBC, is going to definitely be negative in someone who was successfully vaccinated, but it will be positive in someone who previously had the infection but has subsequently cleared it. So you have to know this as the main difference, because this is the really the only difference between someone who was vaccinated and someone who has dealt with the virus on their own successfully. Now let's talk about another pattern. Let's say that someone was very recently infected, but they have recovered from the virus. So what are you going to see here, and why am I even discussing this? Well, this is another scenario. We earlier discussed what would happen if somebody was infected in the past and was successfully cleared out of the virus. We are now going to talk about somebody who has been recently infected and is recovering. So what are we going to see? The most important thing is the IgM anti-HBC is going to be positive, and this will not be positive in the other case where there has been a long duration since the virus was cleared. So this is the only scenario in which you're going to get the anti-HBC positive, in which someone has recently recovered from the infection. Secondly, you're going to see that the HbsAg is maybe negative or on the borderline, or it is becoming negative, and the anti-HBs antibodies are maybe on the borderline or slowly becoming positive. And this is because the body's immunity is picking up, it's getting rid of the virus. But the important thing to note in this case is the IgM anti-HBC will be positive, and this is the only scenario in which the IgM anti-HBC. Let's now talk about the last condition where somebody is not able to clear the virus. This could be a recent infection, or this could be a long standing infection. And in both these situations, we are going to look at two specific markers, which are the only ones that matter: the HbsAg and the HBV DNA. So In active disease, the HbsAg will be positive, and this can be confirmed with the HBV DNA because the virus itself will be present. If if the infection is recent, you will see the IgM anti-HBC being positive because that is the only marker of a recent infection. And in a chronic pattern, you will not see the IgM anti-HBC. You may see the total anti-HBC depending on the condition, but you are definitely always going to see the HbsAg being positive. The HbsAg's presence is indicative of an active infection. Whether it is recent, whether it is a past infection, you cannot say, but HbsAg means that this person is currently infected. Thanks for watching.